So a day in our program is, as the name implies, very intensive. Patients are getting nearly 11 to 12 hours worth of care every single day. So we always want to make sure that we're starting or ending a participant's day here with some kind of integrative therapy. So often something that involves movement or creativity. It's not uncommon that they'll start the day with fitness or yoga or art therapy. About half of someone's day is in different types of skills groups and group therapies. Those skills groups are really focused on tangible tools that someone can use to help them cope with some of the symptoms that they're dealing with. So for example, we have a big emphasis on mindfulness, interpersonal skills, cognitive skills. We have a group dedicated to in vivo exposure, which is essentially helping people reapproach things in their lives that they might have avoided because of the trauma that they've experienced. The other half of someone's day is typically very focused in on individual care. So they're getting daily individual intensive trauma-focused therapy or cognitive rehabilitation therapy, depending on what they need. It's pretty common as well that they'll meet with their medication prescriber. They might make adjustments to sleep medications or other psychiatric medications while they're here. And then they're meeting regularly with their case manager. Because they're only here for 2 weeks, our goal starting from the second they arrive here is to make sure that we're working with them to get really good care back at home as well, so that they can continue the momentum that they've started here. Some evenings that they're here, they're able to engage in recreational activities. Some of them are in the clinic, such as our cooking demonstration with our dietitians. Some of them might be tours of local Boston historical sites to spend some time together as a group. During the middle weekend that they're here, though, we actually have everybody spend the 2 days at a local horse farm for some equine-related activities. So that can include riding or energy work with the horses. There's also the opportunity for hiking and crafting as well. We really see that middle weekend as a respite weekend in between 2 very intense weeks. Many people just use it as a time to reflect and practice their skills and also connect with one another as a cohort as well.
BrainLine is powered in part by Wounded Warrior Project to honor and empower post 9/11 injured service members, veterans, and their families.